Hello, my name's James Riot and I'm a psychology student at UNE. In this video we're going to talk about the principles and practices of motivational interviewing, MI, and then we're also going to apply this to a scenario whereby someone who's engaging in a sedentary lifestyle can be helped with MI to increase their physical activity levels and then improve their mental health and their physical health as well. Motivational interviewing is a technique used in counselling whereby the clinician can help the client move from their current behaviours to their ideal behaviours, and along the way take steps by eliciting the motivations from the client, what makes them driven to make the changes, and then also helping the client to set goals, once again determined by the client, which they feel are achievable and reasonable for them, all in moving from that current to that ideal pattern of behaviour. As a result, motivational interviewing is a collaboration between the clinician and the client and is client-led. So the counsellor plays a lot more of a supportive role and the client is allowed to determine the steps along the way. To help understand motivational interviewing better, there's an acronym that we can use to help us do that, which is RULE. And it stands for resist the writing reflex, understand the client, listen with empathy, and empower the client. So what those principles mean is resisting the writing reflex is often when we hear a story from someone and they introduce a problem they have. The initial temptation is to say, oh, well, this is how you fix that problem, and to provide what we see as a reasonable alternative, which may not actually be attainable for the person to achieve. Understanding the client is helping the client to understand their own motivations and figuring out what those motivations are, why they want to engage in change, and then using that as a powerful driver for the client to make the transition from their current behaviour to their ideal behaviour. Listening with empathy is where we want to support the client, so we show them they're in a very supported environment, and so we aren't judgmental, even if they're engaging in risky health behaviour or it's causing them great distress. We try not to go and say, well, you're doing very poor at this and you're making all the wrong decisions. And then we also want to empower the client, because ultimately we want the client to become autonomous. We want them to be able to make these changes, think about steps that they can do, and then actually fulfill all those actions and then become arrive at the destination that they would like to get to. So you might be thinking, what does motivational interviewing look like in practice? Well, there's another acronym we can use to help us remember what that is, and that's OARS, which is motivational interviewing asks open-ended questions. So we don't want to entrap the client, but rather we want to get as much information as we can. So we ask questions like what rather than why, because why can sound a bit accusatory, whereas what just allows the client to talk about what they think is important, and then we can get a lot of information from that and makes them feel valued and listened to as well. Affirm the client, of course, if they're taking any steps toward their goals, either in the past or they're planning to, we want to actually really encourage them and be able to make them feel like that they have the ability to achieve the goals and make them feel good, positive reinforcement there. We want to reflect, we want to repeat back to the client what they have said to us, and this will make them feel like they've been listened to, but also when they hear what they've been saying reflected back to them, it gives them another chance to think about what they've been saying, and so that will help some of the contemplation. And then we want to summarise. Once again, we want to take all the information once we understand the client's motivations, what steps they think are reasonable for them, and then repeat that back to the client. Once again, it demonstrates active listening, but then it also really consolidates any mode of change for the client as well. So let's think about an example. As we said, we're going to apply this to a scenario of getting someone who's engaging in a sedentary behaviour and engaging into a more active lifestyle. So let's suppose we have someone who's been referred to us, they've just lost their job a couple of months ago. As a result, that means they've been sitting around at home a lot more often and engaging in sedentary behaviour. They've actually noticed that they've put on a couple of kilograms, and because they know in their family there's a history of heart disease, they know that if they keep on putting kilograms, that could potentially exacerbate the heart issues. So they've gone to see their local GP and they've expressed their concern about this, and they're not super happy with increasing their weight, and they would like to get back active again as they were in the university study days. And then the GPs refer them to us as a clinician. A bad way of conducting motivational interviewing, or rather not conducting motivational interviewing at all, is when you first see that patient saying, okay, so I've read your referral, the doctor says that you've increased in weight and it might bring on some heart issues. What I've actually done is I've looked at the internet for you, and I found this really good diet that will help you lose a lot of kilos. And you know what? I do swimming 3 times a week, so I suggest you do swimming 3 times a week too. That will keep you really fit. Do you have any questions about that now? Okay, cool, no worries. And I'll see you in a couple of weeks, and hopefully I'll expect you to have gone swimming and signed up for a club. That shows no client support at all. We don't even understand why they are concerned about losing the weight and getting more active. We haven't even discuss whether they like swimming or not. Maybe that might not be a reasonable method for them to implement to move toward their goal. A better way in that scenario where motivational interviewing could be used is when the client comes in, we say, so what brings you in today? I hear that you have some concerns around your increasing sedentary behavior. And they say, yeah, so when I was younger, I used to be very fit. I used to do running and do some track and field events, and I've just noticed ever since I lost my job, and I've just been increasing a bit, and there's a history of heart disease in my family, and I really don't want to have that happen to me. Straight away, thinking about rule and ors, we're starting to understand why the client wants to change. We're starting to see potential steps they could take as well. They like running rather than what we were thinking with our prescriptive technique of swimming. So we might reflect back to them and say, that's good. Well, you used to be very fit in the past. That's excellent. Do you think you could maybe take steps to do that kind of behavior again? It's like, yeah, I could buy some running shoes and then maybe get back into running. You're like, that sounds like an excellent step. That will certainly be one way of increasing your physical activity, and then that should help you with your weight gain as well. And they will say, yes, that sounds excellent. And then you can summarize all that and say, so I think on reflection, you've expressed that you used to like running in the past, and you feel like you'll be able to get some running shoes this week and maybe start running. Maybe, what do you think a reasonable expectation around this? Like, I'll just try and start by running once a week. And you're like, yeah, that sounds excellent. I really think you can do that. That sounds like a great start. And we see we're empowering the client. We're affirming them, saying it's great that you have this motivation, and it's a great outcome that you want, which is a more active and healthy lifestyle as well. So of course there's a lot more complexities and subtleties than that, but those are the basic principles that we can use to use motivational interviewing to help someone move from sedentary behaviour to a more active lifestyle. Thank you.